So let's talk testosterone replacement therapy in women, which is gaining more and more attention as a legitimate means of treating low desire or low libido, known specifically in medicine as hypoactive sexual desire disorder or HSDD in women. So let's talk testosterone replacement therapy in women, which is gaining more and more attention as a legitimate means of treating low desire or low libido, known specifically in medicine as hypoactive sexual desire disorder or HSDD in women. Now, testosterone replacement therapy has been used and is FDA approved for the treatment of low testosterone, most commonly associated with the complaint of low libido in men. And urologists are extremely familiar in treating and replacing testosterone in men. And more recently, we have looked at the use of testosterone as a way to treat women, particularly postmenopausal women with HSDD. Now, the data so far is small and short term. So far, it appears that testosterone replacement therapy can be delivered safely without increased risks of cancer or heart conditions or other significant medical downsides, especially when monitored and carefully prescribed. There are several small to moderate size studies that have looked at treating postmenopausal women with testosterone replacement, most commonly done as a transdermal or cream that is applied. But other formulations have been studied, including patches and injections. And these studies so far have not shown any serious or significant side effects. Now, there are less serious, potential, more common side effects that every woman patient on testosterone should know about. That includes hair. You might notice a mustache or darkening or thickening of hair in places you do not want hair to be. Testosterone therapy can also increase acne. So you may notice that you are dealing more with dermatologic acne issues when you are receiving testosterone replacement. Testosterone replacement therapy can even enlarge the clitoris. It can increase the size of the clitoris, which may be distressing to some individuals. Testosterone therapy, especially when supratherapeutic or too high, might lead to a deepening of the voice or change in the voice. It's one of the signs that maybe your testosterone is indeed too high. Now, did you know that in normal circumstances, women actually produce way more testosterone than estrogen? Yes, our ovaries and our adrenal glands produce more testosterone than they produce estrogen. Testosterone is not a male hormone. It is a sex hormone that all humans need. Now, our levels of testosterone in women are significantly lower than age-matched levels of testosterone in men. Therefore, replacing testosterone in women should not be at the same dosing as it is in men. As a general rule, testosterone is dosed 1/10 of the dose that we use in men. And in any individual, testosterone should be monitored carefully. After starting any kind of testosterone replacement, ideally, you should have labs rechecked within 4 to 6 weeks. And after any dose adjustment, you need to have labs rechecked 4 to 6 weeks. And even when maintaining the same dose, usually labs are checked at least every 6 to 12 months. Additionally, we look for side effects. And so you should be getting asked if you are on testosterone replacement about any side effects that you might be dealing with. It's important that we monitor for cholesterol, changes in your blood count, and any unwanted side effects. But what about testosterone in premenopausal women? Well, using testosterone in premenopausal women is not usually recommended. And the main reason is because giving a woman testosterone while she is pregnant or when she could become pregnant could be disastrous for the growing fetus. It can affect the normal development of both the internal and external sex organs in the growing fetus. If you are on testosterone replacement therapy and you are premenopausal, it is really important that you have a reliable source of birth control. And as soon as you discover that you might or may be pregnant, you get off the testosterone immediately. Ideally, if women that are premenopausal are prescribed testosterone, they are post-reproductive, meaning they have finished having children in their life. They do not plan on having children further, and they have a reliable means of birth control. More research is desperately needed to understand how testosterone replacement therapy affects women across multiple stages of their life. So how effective really is testosterone replacement therapy in treating HSDD or low libido? So in medical research, when we're evaluating how effective a treatment is for low libido, we often report it as the number of sexually satisfying events over a period of time, something called SSEs. So for instance, in 2005, a study that included over 500 women who received either testosterone or libido found that the women on testosterone had an increase of SSEs over 4 weeks. Furthermore, there is evidence that testosterone plays a critical role in increasing sexual motivation and sexual responsiveness. Testosterone replacement therapy has even been shown to combat low libido or HSDD as a result of antidepressants like SSRIs. There was a study in 2014 that looked at women who had low libido that were on SSRIs and treated with testosterone. And there was a significant improvement in their SSEs, sexually satisfying events, when they were given testosterone. And so this is a very common scenario where you have a patient that is on an antidepressant that can't get off of that SSRI antidepressant. Testosterone therapy has so far been shown to be even effective in that individual. It's important if you are considering testosterone replacement therapy or actively getting treated with testosterone replacement therapy that you're getting monitored, that you understand the risks and the benefits. There is no standardized goal level of testosterone when it comes to treating women. And so our dosing is primarily based on symptoms. How are your symptoms improving? Chiefly, how is your libido improving? That might mean that technically your testosterone may still be considered low, but if your symptoms are improved, that should be the guiding principle. On the other side of things, if testosterone therapy is not helping your symptoms and it's been at least 6 months on testosterone replacement therapy, then it's a good idea to stop it and look for other solutions to treat your HSDD. So there it is, testosterone therapy for women. Let me know what you think. What are your thoughts? What are your questions? Put them down in the chat below. I want to know. As always, subscribe. Make sure you join me every week for all things down there, right here